Welcome to CAREN. I'd like to introduce myself. I am the human body model. It's a pleasure to show you the CAREN system. I will show you the possibilities of this system and tell you how it is used. CAREN is short for Computer Assisted Rehabilitation Environment. This system allows patients to train in a controlled environment. The CAREN system is developed by the Dutch company Motec Medical. The system has been operational at the Military Rehabilitation Center in Doorn since July 2008. Therapy and projects have evolved ever since. The developments consist of new types of therapy, writing protocols, creating new applications, and performing scientific research. The time the system is used is divided in 60% time for treating patients and 40% time for scientific research and projects. During therapy sessions, patients are playing games that are designed to achieve specific treatment goals. Because these games are not just entertaining, they are also called serious games. The CAREN operators, who all have a therapeutic background, will make sure that the treatment on CAREN is in line with the treatment goals of other therapies from a patient. During treatment, the patient stands on a platform that is on top of a motion base. The platform has 6 degrees of freedom. 3 translations: heave, sway, and surge. And 3 rotations: pitch, roll, and yaw. And all combinations are possible. The infrared cameras around the platform can detect reflective markers that are placed on the patient. The movements of the patients are sent to the D-Flow software. This technique is called motion capture. I am also standing on 2 force plates that measure the forces I exert on the ground. With all this information combined, you can see which muscles in my body are working at any given time. This way, you can really see the effect of a good workout.
I'm sexy and I know it.
To make this all possible, 47 markers were placed on my body. The cameras, the motion base, and the projectors are in a real-time feedback loop. This means that all movements can be directly visualized and that the system can react instantaneously to incoming data. In our environments, patients are challenged to learn certain skills. The therapy at CAREN mainly aims at improving balance, stability, coordination, and mobility. Treatments can also reduce fear of movement by letting patients discover their physical and cognitive possibilities. Because patients wear a safety harness that is attached to a steel frame, they cannot fall on the ground. If a patient does lose balance, the harness will provide full weight support. Various patient groups exercise on CAREN in various environments. They can walk in a forest, or sail across the ocean. All applications can be adjusted and the exercises can be offered with increasing complexity. For instance, platform excursions can be small and gentle or big and violent. The environment can be peaceful or very vibrant. And we can ask a patient to focus on one thing at a time, or we can offer various dual tasks. Patients conquer fear and discover new strategies to cope with their handicap. They can integrate these strategies into their daily life together with the rehabilitation team. Patients are very content about the treatment on CAREN and indicate that it is a useful addition to their rehabilitation program. All the equipment of this system is not only used for therapy, but accurate measurements are performed here as well. Gait analysis, for instance. Because the possibilities of this system are so extensive, several research groups come here to use this system for scientific research. This is all I have to say for now. We would like to thank you for your attention, and now it is time for some volunteers to experience what it's like